Australia's wading through uncharted waters tonight as we deal with the growing coronavirus emergency. From Monday, all non-essential gatherings of more than 500 people will be cancelled. The AFL is meeting to formulate its response to the pandemic. Fans are fuming after the brakes were slammed on the Grand Prix. And pharmacists are restricting sales following a rush on paracetamol. First to political editor Chris Uhlmann. Now, Chris, take us through what the Prime Minister had to say.
Well, make no mistake, Pete, Australia is on a war footing. The nation hasn't faced a crisis like this since 1919 when the Spanish flu hit the nation. For the first time in our history, we're to have a national cabinet, which will be made up of all the premiers, the chief ministers and the Prime Minister. It started making decisions today. One of those is that from Monday, all non-essential gatherings of over 500 people will be banned. All overseas travel is being discouraged. Now, the aim is to slow the spread of the virus so it doesn't overwhelm our health system. Here's part of what the Prime Minister and the Premier had to say today.
What we're announcing today is just another step. It's precautionary. It's getting ahead of this to ensure that we can minimise the impacts on your health.
We are all absolutely determined to work together to make sure that we keep people well, that we have less incidence of this virus and this disease than would otherwise be the case, and therefore have less people die.
And Pete, in breaking news, Cabinet Minister, Home Affairs Minister Peter Dutton has been confirmed as having the coronavirus himself. And of course now questions will be asked about when was the last time he was in touch with people like the Prime Minister. The only thing that we can be certain of now is that life as we know it is about to change dramatically.
Extraordinary times. Thank you, Chris. Well, the AFL is tonight grappling with what to do this season. Tony Jones is at league headquarters. Tony, footy is very much in limbo.
Well, it is, Pete. I've got to say there's so many balls in the air at the moment, the AFL not knowing which one to actually grasp. Now, there are a number of options at their disposal. We'll get to those in just a tick. What we are waiting on, though, is word from the AFL, a statement of some sort to let us know what has transpired as a result of these executive meetings today. Now, in terms of the actual options, they can go through with the first round next week, which starts next Thursday night. Richmond Carlton at the MCG, the traditional opener, but with no spectators. So they can do that for the opening round. They can do that for the first 5 or 6 rounds if need be, but they might do it for the first round and then decide what to do for the remainder of the season. Now, that might be a shortened season. That would come at a huge cost for the AFL. The broadcasters would come into play, memberships would come into play, sponsorship, it goes on and on and on. Or they might just push the fixture back. Now, that would be difficult because cricket comes on the back of football pretty swiftly, and then it would throw things like Anzac Day into turmoil. Suddenly Essendon and Collingwood don't have a mortgage on that. You've got the clubs who've been gifted Good Friday, etc., etc. So that would also come into play. So what we have, actually, just hang on. Okay, so all right. So at the moment, I'm being told that the AFL is actually on a conference call with all the clubs at the moment. We should know something in about 15 minutes from now. So that's the latest. The clubs are being briefed on what action the AFL is taking. We should know something in 15 minutes. But as we do know, as Chris Uhlmann told us, the Prime Minister had a media conference today and in that effectively forced the AFL's hand to some degree.
The fact that I would still be going on Saturday speaks not just to my passion for my beloved Sharks. It might be the last game I get to go to for a long time.
Okay, so Scott Morrison, fantastic for the Prime Minister. He's a rugby league supporter, and because of this bizarre decision to actually delay this gathering ban until Monday, it means that the NRL actually has a full weekend of audiences. Fantastic for the NRL. Other codes have actually been a little more combative, if you like, when it comes to tackling this issue at the moment. The racing, for example. Now, horse racing will go ahead at Caulfield tomorrow. The All-Star Mile, the $5 million race, no spectators. Cricket being played at the SCG today, Australia and New Zealand, no spectators. Victoria and Tasmania at the Junction Oval, no crowd there. You've also got soccer. The Australian women's team was planning a trip to America. That's not going ahead. Ice hockey in America, the NHL, following the lead of the NBA, it's not going ahead on the eve of what is its playoffs. And then back home, the NBL, the local basketball, the grand final series between Perth and Sydney will go ahead, the remaining matches, but in front of no crowd. So that's the latest, Pete. But as I say, no decision by the AFL, but judging from the communication only a moment or so back, we will have something in about 15 minutes.
Thank you, Tony, and we'll be back to you then. Formula One fans are furious after they were left waiting in queues to be told the Albert Park race had been cancelled. Despite the disappointment, organisers haven't given up hope on staging the event later in the year. Brett McLeod reports.
It was left to a lone official with a loudhailer to break the news.
Let us in. The AGPC has been informed by Formula One of the cancellation of the race.
This is just disgusting. They've had plenty of time to cancel the race.
We're very disappointed, yes, because we've come all the way from England for this.
Speechless. Gutted, speechless, I don't know. My emotions can't explain anything.
While the final call was made by the sport's governing body, it was the teams who were in the driver's seat. The race had been in limbo since McLaren announced it was pulling out after a team member tested positive for COVID-19. Mercedes wrote to organisers, with regards to the coronavirus pandemic, we no longer feel the safety of our employees can be guaranteed. By 6:15 this morning, drivers Kimi Raikkonen and Sebastian Vettel are understood to have already flown out of the country, having for days said there was no medical advice to cancel the Grand Prix. At 9 this morning, the Victorian Premier had a very different message.
On public health grounds, there will be no spectators at the Grand Prix this weekend if a race actually happens at all.
Fans were still queued up an hour later, waiting for the official word.
I think everybody's feeling exactly the same. Look at it, everybody wearing masks. Have a look, nobody cares. We don't care, let us in.
Eventually, the inevitable was made public.
To our race fans, I'd like to say we're terribly disappointed that the event can't go ahead.
The F1 boss says it was a joint decision, eventually.
Were there differing views and differing opinions? Yes, in hindsight, it obviously looks different, but when things were changing as rapidly as they were, I think we were dealing with it, in real time.
To put a stop to the race, it's very difficult for the governing body, and they've finally made the right decision. I'm sure some people would rather it was earlier, but it's a difficult decision to make.
Daniel Ricciardo says he's devastated. Ultimately, the right decision has been made. This is something we've never seen before. With Melbourne's race off, it raises serious doubts about the next two events in Bahrain and Hanoi, with China already postponing the season's fourth Grand Prix.
The situation today is different than it was 2 days ago, which is different than it was 4 days ago. So trying to look out and make those sorts of predictions when it's changing this quick, is challenging.
Organisers haven't given up on Melbourne getting the green light sometime this year.
We look forward to hopefully being able to run this event at some later stage.
But to fans big and small, today felt like the pits.
I'm very sad that I didn't get and be a good kid.
Now, Brett is at Albert Park. Brett, what happens now for those disappointed fans?
Well, the Grand Prix Corporation, Peter, has ensured that everyone who holds a ticket will get a full refund. But there's another financial battle yet to be paid out. As we know, taxpayers subsidise the race to the tune of about $60 million a year. What happens now with the race being called off? It depends very much on the debate between the state government and Liberty Media, which owns the rights to the Grand Prix.
Brett McLeod reporting from Albert Park. And another of Melbourne's most popular events has just been mothballed. Reid Butler has this breaking news. Reid, what is it?
The Melbourne International Comedy Festival. Pete, organisers say they're devastated by the decision, but it's the only option if they want to support the community in its efforts to slow the spread of the virus. The festival was supposed to be held from March 25 to April 19, bringing thousands of tourists and millions of dollars into Melbourne. We've also just learned that Luna Park will be closing its doors for the next 2 weeks at least. These just the latest high-profile closures and cancellations. This crisis now hitting every corner of our city. In the suburbs, this is the new reality. Today, hundreds queuing for hours at a coronavirus testing clinic in Clayton. It's just one of 7 such facilities across the city.
We don't know what to do.
Tamika Hicks is stockpiling nappies at her Pakenham childcare centre, but running short on other crucial supplies.
We need to be able to change children's nappies and be able to wipe children's noses and provide those basic care requirements.
It may not matter soon, though, with the centre likely to close because of the worsening crisis. That could force parents, like working single mum of 2, Christy Bastian, to give up employment.
There's no way I would be able to keep up with my rent, let alone my, electricity, water, everything else, car insurance, phone bills.
Supermarkets are still struggling with supply. This morning, toilet paper was distributed by staff behind the counter of the bakery of Coles in Richmond.
We're struggling to keep stock on the shelf.
Painkillers and prescription medication running low at pharmacies too.
We've put a limit of 1, maximum 2 bottles on Panadol and Nurofen, just so it goes around.
From panic buying to price gouging, this convenience store is selling hand sanitizer for $15 a pop, while this news agency in Toorak will soon no longer accept cash.
We're just trying to minimise the risk and protect ourselves. I think we are very lucky because our boss is very considerate and is just trying to protect us.
More events have been cancelled, including the Robbie Williams concert at Albert Park, the Little Athletics State Championships, all Relay for Life fundraising events, and the remainder of the Fashion Festival. Also under a cloud, the Melbourne Food and Wine Festival and the International Flower and Garden Show. Reid Butler, 9 News.
As the crisis deepens, misinformation is also spreading. Let's go to medical reporter Emily Rice, who's with leading GP Mukesh Haikawal.
Doctor, firstly, what should people do if they feel sick with cold and flu-like symptoms?
The season is coming of cold and flu symptoms, and we have to be aware of that. The first sign of a runny eye, runny nose, sore throat, it doesn't mean you've got anything nasty. Stay at home, try and stay away from other people, and stay well, plenty of fluids, rest, drink and eat properly. If you are got prolonged symptoms or you're getting worse, then call ahead. Call ahead the practice. The practice will organise for you to be seen either by video or by teleconference, which is now new as of today, or they'll get you to come in and be seen and be potentially tested, or if they can't test you in the practice, they'll get you to go somewhere else. But the most important thing is, number one, don't panic. Number two is to get your self settled and relax and try and get better. And if you're not getting better, then come and see us.
And what are the other precautions that individuals can take now to try and protect themselves from the virus and also perhaps protect the spread?
The most important thing is personal hygiene, and that's personal hygiene in the home, personal hygiene in the workplace, and it means hand washing. It means some of these things about not doing the old greetings just now and making sure that you keep your distance. So the social distancing is quite important. In our practice here, my great team has put together a waiting room which is half the number of chairs that you have, with distance between everybody coming in. And nobody comes into the practice without being properly asked a decent set of questions about their risks, to reduce the risks for them, the risks of my staff, and the risks of other people in the waiting room. This is about risking the whole situation.
And just finally, for those who are unfortunately diagnosed with the virus, what happens next, particularly those people who are otherwise healthy?
Again, when there is a diagnosis, there are many things that will happen, including testing, potentially CT scanning, and potentially going to hospital. And none of these things necessarily need to be dangerous. There are a small number of people who are in danger who may end up in intensive care and on ventilators. But that's extremely rare. The vast majority of people will do all right. But the problem is with those people we're trying to minimise. We're trying to minimise the load on the hospitals, on the load of hospital beds, on the load of respirators, and in general practice, primary care, we've got everyone's back. We've just got to be allowed to have the tools and the ability to do this, and we can do it and do it well. We are geared up for this across the whole sector.
Well, thanks for your precious time, Doctor, and I think the take-home message is stay calm, even though it is a very serious situation. Maintain those hygiene habits and a little bit of common sense.